Meanwhile, the president tonight is putting on the finishing touches on what he hopes will be a game-changing speech about health care reform. That speech, a joint session of Congress and the nation, will take place tomorrow night. But the big question tonight, what exactly does Mr. Obama need to accomplish in that speech? Political reporter Dave Evans has more.
Republicans have called tomorrow's speech Obama's Waterloo, a make-or-break speech to a joint session of Congress. The White House has wavered on a public option this summer, a government-run plan to compete with private insurance. But yesterday, the president hinted that idea is still on the table.
And I continue to believe that a public option within that basket of insurance choices will help improve quality and bring down costs.
Republicans have said a public option is too big, too expensive, too much government.
Government taking over more will end up costing more. But remember, Medicaid is almost bankrupt. Who runs Medicaid? The government runs Medicaid.
Yet on Capitol Hill, many liberal Democrats say no public option means it's a deal breaker.
On Wednesday night, when the president gives his speech and sends us charging up that hill for a public option, he's going to get it. But if he doesn't and he retreats, that's what it's going to be, a retreat, and a lot of us will be very disappointed.
This summer, in town halls across the country, Americans debated fiercely over universal health care and what they want or don't want from their government.
Why do you continue to support a Nazi policy?
On what planet do you spend most of your time?
And today, a new round of commercials began. No wonder Americans are confused about what the president's planning.
Choose your own doctor. Make your own decisions.
Their health care proposals do not guarantee you can keep your own doctor.
Tomorrow night, the president needs to lay out his vision in clear, understandable language. The fear is Obama's plan will end up just like the Clintons from 15 years ago.
But the message now is something has to be done. The tragedy will be if nothing is done.
Well, Democrats, of course, have enough votes in both the House and the Senate to do whatever they want. But if they force a plan on Republicans, they could pay for it in midterm elections next year. But even before that, Democrats have to settle on one plan, perhaps the president's plan. That hasn't happened yet. So a quandary.
Dare you have a prediction?
I would expect probably something will be approved this fall. One of the top Democrats this afternoon said, yes, something will be approved this fall, but probably not a public option.
Okay. We'll see.
David, thank you very much. And by the way, you can watch the president's speech tomorrow night at 8 o'clock right here on Channel 7. And if you're not near a television